Um, Minister, let me ask, do you remember your first truly political engagement? Just your truly first political engagement? Because when I was walking down here today through the North Inner City to get here, I was reminiscing upon mine. It was about 2008. I was in first year in university. I was taking an interest in my community for the first time, and a really incredible community leader named Fergus McCabe. I went to him telling him I'd like to get more involved. He suggested to me that I should go on the North Inner City Drugs and Alcohol Task Force. Really great guy. He was a big help to me along the way. I went on to the North Inner City Drugs and Alcohol Task Force in 2008, and I was there as a community representative. And as a community representative, I sat around the table with the project workers, with representatives from the HSE, there was politicians there. And the issues that were coming up in 2008 were an inability to access funds, a lack of recovery bed, poor understanding of the connection between mental health, and by mental health I mean trauma-informed mental health, and the reasons why people get involved in addiction. They are the exact same issues which 12 years later, when I call around to the various different drugs projects and talk to people involved in trying to hold back what is an epidemic that has been ongoing in my constituency and constituencies such as mine for the past 40 years, they are the exact same problems that are happening now, 12 years on from when I was on that drugs task force, and probably 40 years on since drugs first penetrated around the corner in the North Inner City. And the absolute definition of insanity is doing the same thing over and over and over again and expecting different results. And yeah, here we are even today talking about the same strategies that have failed. I think there's a lot in the national drug strategy that is empathetic, that is meritorious, but 3 years into it, what really has changed? What's changed for the service provider? What's changed for the user? The exact same things. Minister, I listened to your speech for 15 minutes into your speech on public health and a national drug strategy, and I can't comprehend how a minister with responsibility for those issues in 15 minutes of conversation doesn't mention the word trauma and doesn't mention the word poverty. Because if we step away from those two issues and take them away from our understanding of the reasons why people engage in that, well, then we're doing them a disservice that has been replicated for 40 years. If you walk down, we talked about Healthy Ireland in your initial address. If you walk down the canal there and talk to the poor people in the throes of addiction about Healthy Ireland, I mean, you might as well be speaking a different language. Those people have been impacted by trauma. And that's what has them engaged in poisoning themselves in the manner that other people have poisoned themselves in this constituency and constituencies such as mine for the last 40 years. And unless we address that in a real, practical, scientific, evidence-based way that's rational, that steps away from moralising, well, then we'll be back here again in 12 years' time talking about the exact same things. Minister, I want you to do well. I really do. I want to help you do well. But I'm not going to sit here where we replicate the mistakes of the past. And that's all that seems to be happening here. So, Minister, I ask, what is the strategy? It's a strategy, once again, that we can continue on with this weird, strange war on drugs, and that will fail consistently. Always has, always will. Do we talk about another type of attrition that seems to happen, where we falsely believe that we can help enough people to recover to offset the fact that there's a conveyor belt of people coming through? Because you know we're lying to ourselves there. I mean, we don't have enough recovery beds for that policy to be successful. And in addition to us not having enough recovery beds, there is any number of people out there willing to get engage in this destructive form of self-harm, because the alternative is to live in trauma. And if we're not addressing that, we're doing an incredible disservice. There is evidence of how we can stop people getting involved in this pursuit. Prevention. There is models that work elsewhere. The model of decriminalisation and healthcare force in Portugal. The fact that we're not doing this yet here in Ireland it's shocking. There is the Icelandic model also. 20 years ago, Iceland too had a problem with your young people getting engaged in drug addiction. And how they responded to that was they invested in opportunity for their young people. They provided them access to sport, access to culture, to music. They've taken down drastically reduced the number of young people engaged in negligible drug-taking behaviour. But they've also had offshoots in that in terms of being successful in sport, successful in culture, more than holding their own for a little nation. And there is absolutely no reason why we can't do that, with the exception of one big one: the moralising, the fear to actually embrace the fact that what we've been doing for 40 years is wrong. And until we address that, until we accept that, until we accept the fact that, that criminalising a person who is injecting themselves with poison or taking a poison because they're dealing with a trauma is wrong, until we step away from that, we're just going to keep replicating those mistakes, and we are complicit in it. And the state has been complicit in it. A generation of successive ministers who've engaged in this have failed to a certain degree. And until we accept the science, accept the reality, we're going to continue to do that. Minister, I want to help you, but let's do it in a rational way. Let's learn from the mistakes of the past. Let's talk to the leaders in these communities and let them devise the plan, and let's invest in it. It will be costly, but it will be paid back 20-fold. Thank you.
Thank you very much.